Just got home from work, but I said I was not going to let the sun set on this day before I made this post. Ready to learn about the differences in the calcium channel blockers? You're going to like this one. On today's episode of Make It Make Sense Cardiology Edition, I am going to teach you the differences in the two different types of calcium channel blockers that you may see your patients get. Inpatient, outpatient, they're available and used in both places. Lock in, let's learn. So remember, on a previous post, we talked about the two different types of beta blockers, how you have the cardioselective beta blockers and you have the non-cardioselective beta blockers, right? The world of calcium channel blockers is very similar. With the calcium channel blockers, like I said, you have two defining categories, and the delineating factor in defining those two categories lies in one specific chemical compound called dihydropyridine. We're going to call it DHP for the purposes of this video. Try to keep things nice and brief. Now, the calcium channel blockers, though they do have some similarities, it's in the name. They block calcium from going into cells in certain areas of the body. Where they take effect is the difference. Now, with those calcium channel blockers that contain DHP, again, that is dihydropyridine, for those calcium channel blockers that contain this compound, their targeted area for effect lies in the smooth muscle vascular tissue. So they work on the arteries. Now, when these calcium channel blockers bind to their respective receptor sites, what that does is that it causes the arterial walls everywhere, causes the arterial walls to become relaxed and even a little dilated. When that relaxation and that dilation happens, that decreases peripheral vascular resistance. It tells the heart you don't have to work as hard to push blood through otherwise tightened vessels. And when the heart doesn't have to work as hard, blood pressure comes down. Now, these DHP containing calcium channel blockers, these are your most commonly recognized calcium channel blockers that end in the suffix PINE, pine. So these are your amlodipines, these are your nicardipines, your nifedipines, ends in that suffix PINE. The way that I learned it in nursing school, I had to teach myself a mnemonic device. The way that I taught myself in nursing school was that the pines have the dene. Got it? Your pine calcium channel blockers contain dihydropyridine. So your pines have the denes. Now, your other type of calcium channel blockers, these are the non-DHP containing calcium channel blockers, and these are your diltiazem and your verapamil. Now, again, calcium channel blockers block the influx of calcium, but their site of action is different. The non-DHP calcium channel blockers, instead of working on that smooth vascular muscle, they actually work in the conduction system of the heart and on the myocardial muscle of the heart. What these calcium channel blockers do is that they block the calcium influx that comes through the conduction system, specifically between the SA node, the natural pacemaker of the heart, and the AV node, that bundle of nerves that's in the middle of the heart. When that calcium influx is blocked at that site of activity, it actually slows down the conduction of electricity between SA node and AV node. When you slow down the conduction of electricity, you also slow down the heartbeats, because remember, it is the electrical conduction system that governs the heartbeats and the heart rhythms, okay? Now, the non-DHP calcium channel blockers also work on myocardial muscle, in that they tell that muscle to relax the force of the contractions. Chill out. You don't have to beat as strongly and as harshly. Relax. So you've got slowed conduction and you've got relaxation of the force of the contractility. And it is this reason that a lot of the ER physicians and, you know, other doctors and providers in the hospital, they elect to use diltiazem as first-line treatment for patients who come into the ER with rapid atrial fibrillation, rapid atrial flutter, because it literally slows the heart rate down. Makes sense, right? Told you, you're gonna like it. Quick and easy, today's lesson. I promised myself I would get it done. Hope it was helpful. If there's any other information that I can expand on regarding the calcium channel blockers, please, y'all know how to DM me. You know how to send me a message. I am happy to expand on whatever you need me to. And if there's any additional topics you want me to cover, happy to do so. And do me a favor also, for anybody who has watched this video and left a comment or like or whatever, let me know where you're calling from. Lord, I'm tired. Let me know where you're watching from. I'm very curious to see where this content is reaching. Okay, I'm going inside to have dinner. Chat with y'all next time. Bye.